Okay, hello students. So this skill that we're going to do today and that I'm going to put on for this week is a central line dressing change. Central line dressing change. So it's relatively easy. It's not a very hard skill to learn, but it is a sterile technique. That's what makes it hard. And so we must pay close attention to our sterility as we're moving back and forth between non-sterile and sterile items. So pay attention to that. Let me, however, just talk about a central line just a little bit. Central line is, lines, the larger lines that go in like the chest. You've got portacath, metacath, groshongs. This is a single lumen, so we're dealing with this one here. Those are usually put in patients that are going to require lots of medications or large amounts of fluids or thick viscous type fluids, things of that nature, or the patient is a hard stick. So if you got a patient that is, in the hospital a lot and they're going to be getting stuck, and getting fluids, medications, and the doctor may recommend, if they're a hard stick, that you just put in a central line, have that put in, and then that way you've got access all the time. These are good, like I said, for the thick viscous solutions, medications, stuff like that. Blood products, very good for that. TPN, good for that. Chemotherapy, very good for that. And it's just because this line goes into the large vessels. And so those large vessels can accommodate large amounts of fluids, medications, thick viscous type stuff. Where the smaller vessels down here, the veins down here, can't do that so readily and may cause phlebitis and things of that nature. That's kind of what those are for. The big thing about them is losing them to an infection, and we don't want that to happen. So we want to be very careful with our sterile technique as we do change this dressing. Dressing change is going to be about every 7 days, and that could be a little different between hospital policies and stuff like that, so be aware of that, but about every 7 days to change the transparent sterile dressing that's on there. So let me just talk quickly about your supplies then before I get started. We're going to need a face mask. I think, it's, again, a policy thing. Some policies may say anybody that's within 3 to 4 feet of the patient watching you do this or something like that, a family member, somebody else learning, training, whatever, has to have a mask on. I prefer anybody in the room. I don't care where they're at. I don't care how far back they are. I prefer everybody in a room, if they want to stay in there and watch, to have a mask on. So definitely got to have a mask. Then you want a pair of clean gloves. Yes, clean gloves. We're going to start out with clean gloves first. And then you got to have a packet of 3 alcohol swabs, 3 betadine swabs, and of course we're going to ask our patient if they're allergic to betadine. If the patient is allergic to betadine, then we can simply use CHG, chlorhexidine gluconate, if you want to look that up, CHG, and it's an alcohol, more of an alcohol-based type cleaner, so you can use that. I think the betadines are a little bit more old school. I think pretty much everybody's going to CHG now, but I'm going to show it to you this way. If you can do it this way, you can do it anyway. You're going to need a transparent dressing, okay? And so I'm just going to use a opsite here just for, it's easy to use to demonstrate with, but some of the dressings can be quite large. And so when you clean, as I'm cleaning, I want to make sure that I clean out a large enough area that it's bigger than what the dressing is, because I want everything under that dressing to be totally disinfected. I don't want any microbes living under there, surviving under there where I'm going to have that dressing. So I'm going to clean out a spot bigger than what my dressing is. And then, of course, I've got to have a pair of sterile gloves. And so before you get started then, what you want to do is make sure that you wash your hands or sanitize. So I have my hand sanitizer here, so I just put that up there as a prop. So you do your hand sanitizer, and I'm going to move that out of my way now. I prefer washing your hands. I like going in the patient's room and letting them see that I am going over to the sink and washing my hands really good with soap and water. I think they deserve to see that. These are very important, so I want them to know how important that I think that central line is, and that I'm very careful with microbes and that kind of stuff. So having said that, then we're just going to get started with our first initial step. So first thing that I got to do is I'm going to remove the tape here. Usually there's a piece of tape here holding this part up. And then there's the sticky transparent dressing that's on there. And so what I'm going to do is, before I remove that, I'm going to go ahead and get my face mask. And of course, as I said, I'm going to put a face mask on anybody in the room. Some policies may say only if they're within 3 or 4 feet, and that's, a policy thing. So just follow your policies. So I got my face mask on, and I'm going to go ahead and put my clean gloves on. Now again, I want to remind you that these are clean gloves, not sterile, so we have to be careful. So there's a certain way we're going to remove the dressing. So I'm going to first peel the tape off here. To save time, I'm just going to go ahead and get it pulled off of there, all right, so that you know. And I'm going to drop this down in my biohazard bag, or my can here with my biohazard bag in it. And then I'm going to start removing this dressing. Now you can see the dressing is over top of the tube here, and about right there is the insertion site, about right there, okay? And so what I'm going to start doing is I'm going to start peeling the dressing toward the insertion site. Okay, and we do that with all of our dressings. That's the way we train you, to always pull that dressing, pull tape, anything like that toward that wound site. And so I'm just going to keep working that like that, little bit by little bit, to there. And I'm not going to expose the insertion site. So that insertion site is going to remain under this dressing because I don't have sterile gloves on yet. So then I'm going to start, once I got one side done, I'm going to start on the other side, and I'm going to start peeling that little bit by little bit toward the insertion site also. And I'm going to be very careful, okay, not to pull or tug on the line right here until I get ready to remove this dressing. So I've got most everything pulled off over here to where it's manageable. Now it's small enough. Let me move that hand right there. It's small enough, the dressing right here is small enough that I can just peel this back. And what I'm going to do is literally just peel it back like that. And so what happens when I'm ready to just peel this whole thing back here is I'm going to clamp down on the line here. With this hand here is going to hold the line, because that could pull out. They are sutured in, but they are also easy to break that suture and pull that line out. And we don't want that to happen. So I'm going to hold this down really, really firm, and I'm going to peel this back, this dressing off, just like that. And so at no time was my unsterile glove over top of my insertion site or the wound, so it could not get contaminated by something dropping off my glove. And so again, I'm going to inspect for drainage or anything there, and put that in my biohazard bag. And I'm going to inspect the site here. So I want to look for signs and symptoms of infection. Do I see any drainage coming out of it, any blood coming out of it, any redness around the area? I expect to see mechanical redness. That's the normal redness that you would see around, an IV catheter stuck through the skin, something stuck through the skin. So you expect to see that mechanical redness. That's the normal redness around it. But is this redness spreading out from there? It's different. It's getting larger. Do I smell any foul odor? Anything? So any signs of infection. And then I want to palpate. Don't palpate over. Don't get too close. But if I do see, reddened area, is it hot to the touch? That's another sign. And then basically just asking them, is any place that I'm touching tender to the touch for you? And don't reach over top. So I'm not actually reaching over top to where anything could fall off my glove there. Okay. So once I've inspected and it looks good, I don't see any signs and symptoms of infection or anything like that. So I'm going to strip my gloves off and drop that down in my biohazard. So now what I want to do is I'm going to rewash my hands or re-sanitize. So I'm either going to re-sanitize or rewash my hands. Okay. And so once I do that, I'm going to come back over, and then I'm just going to open up all of my stuff and get that ready. So these packages are not sterile. The outsides of these are not sterile. So the inner content is sterile, but the outside is not sterile. So what I want to do is I'm going to go ahead and open these up prior to putting my gloves on. Okay, and what I'm going to do is just scoop these swab sticks up a little bit to where I can get a hold of them relatively easily. And I'm going to lay that off the edge of my table, okay? So they're not touching anything on my table. Now, I'm not going to reach over top of those, okay? So make sure that once you open them, you don't reach over top. Okay. There we go. And again, I'm going to lay that off the overbed table there so they do not touch. The sterile ends do not touch. They're protected. And then I'm going to move over here and I'm going to open up my dressing. Okay, and just have that there so I don't reach over top of that. All right, and then I'm going to move around. And so now that I've got all my stuff open, I'm going to go ahead and put my sterile gloves on in sterile fashion. Okay, so all of my students, they know how to do this part, but I'll go ahead and show you again. Okay, so I'm right-handed. Hope you can see this. And so I like my right hand to go in first, so I'm going to reach in here, duck method, duck method, and I'm going to reach in, thumb goes in the cuff, and pick this glove up. This one's sticking a little bit, so I'm going to touch the cuff here and just kind of peel it apart a little bit. Pick straight up, all right? Don't slide it off. Take a step back, but I'm going to make sure I get here in the camera so you can see, okay? And I'm going to put my glove on. So notice I'm only touching the inside. This is the cuff that will go to the inside of my skin, so at no time do I touch the outside there, okay? Now I'm going to come over here and then I'm going to scoop method. This pulled apart here. And I'm going to scoop up like that. Get all four of my fingers into there. This thumb here stays back like a hitchhiker, like you're hitchhiking, because I don't want that to go forward like that. That's too close potential for contaminating. So I'm going to keep that like that, and I'm going to get over here in the camera a little bit, and just going to put my hand down in there, and there we go. And once I do that, prayer position, and I'm going to move back around in front of the camera, okay? So what's going to happen now is I'm going to have to contaminate one hand, keep one hand sterile. So what I'm going to do is I'm going to use my non-dominant hand to grab the outside part of this pack. So this hand is now contaminated, but this hand remains sterile and will only come up here and touch the inside. The sterile, can't see that really good, but my sterile sticks here until I pull them out. It's kind of hard to see with the light the way it is. And so lay that back off the table there, and then that way I can use my contaminated hand to manipulate my sterile, or excuse me, my central line down here. Don't get really close to the insertion site as you're cleaning, because this is a non-sterile glove right here. But this down here is certainly not sterile anyway. It's not cleaned yet. We haven't done anything to that. Okay. So what I'm going to do is start right on the insertion site right here, right on the site with this alcohol, and I'm going to go around, come underneath the tubing, and press down on top. And I'm going to go around and make circles all the way around, go underneath the tubing, and then press down on top. Go around, underneath the tubing, press down on top. And I'm going to keep working this out like that all the way around. Okay, making sure I get under and press down on top and keep working that out like that all the way around. Once you go over the area like that, don't go back over it with the contaminated swab. Keep moving out in a circular motion and keep getting bigger and bigger and bigger with your circles, okay? So I've got swab number 1 done. I'm going to put that in my biohazard bag and get my swab sticks again. So there's my sterile sticks. and I'm grabbing only the sterile part of that with the sterile glove. Start again. Now this is a new swab. So I'm going to start right on the insertion site again. This is a new swab. I don't want to go back over it with an old swab, but with a new swab, I can go back over the same site. So I'm going to start right there again, saturate that good, kill out anything that may be there, go around underneath the tubing and press down on top. And so what I'm doing is, the reason I keep going underneath the tube, and I keep saying that, is that you are literally cleaning and disinfecting the tube, okay, as we go out in that circular motion. Okay, so underneath and press down. So I'm saturating underneath there and then pressing that down too, and working that out as big as that dressing will be. All right, and dump that in your biohazard bag. And then I'm going to take the third one, and I'm going to go ahead and get rid of that and do the same thing. Start right on the insertion site again and go around underneath the tube, press down on top, and you're just going to keep doing that over and over, and just watching where that you have been, and make sure that all of that skin area is disinfected really well with the alcohol. And so then we're going to wait at least 30 seconds and let that dry. And so we're going to say time lapse, 30 seconds has went by and it has dried. So then we're going to start with our betadine. We've already asked our patient if they were allergic to betadine. And I think I talked about the if they are allergic to betadine, you can use CHG. CHG is chlorhexidine gluconate, and so it's more of an alcohol base to it. And so if they are allergic to betadine, use the CHG. I think the betadine swab sticks are a little bit more old school. Most everybody's going to CHG now, but if you can do it this way, you can do the CHG for sure. Okay. So then what I'm going to do is, after that alcohol is dried, I'm going to do this the same way. So I'm going to start right down on the insertion site and saturate that good. And then I'm going to come down here and go underneath my tubing and press down on top. And you can see, so you couldn't really see what I was doing with the alcohol. But with the betadine, you can see exactly what I'm doing. And so that's the betadine. Alcohol kills the germs. It breaks down their cell wall. Okay, and you just keep going like that. And so that's a pretty good show right there. All right, so I'm gonna put that in my biohazard bag and get my next one and start right back at the insertion site again. And so you can see that one was a really good one. And I'm going to go around and underneath. Now, like I was saying, explaining the alcohol, alcohol breaks down the cell wall of the microorganisms and kills it. Okay, betadine makes it really inhospitable for regrowth. So it can kill the microorganisms, yes. And see, I keep pressing down on that, making sure that's getting that area. Okay, and I'm going to get rid of that one. And then the third one, I'm going to do the same thing. So I'm just going to press right here on the site. And again, that's a good one too. And so then go around and press down on top and go underneath the tube and press down on top. And you're just going to keep working that out in that circular motion, making sure that you're disinfecting the tube and everything, making it extremely inhospitable to microorganisms. All right, and so we've got that done. So with this, you're going to let that dry, however long that takes to let that dry, several minutes. So you can talk with your patient, talk with patient family members, do whatever they need to do. Okay, so then basically then what you want to do is just take your sterile hand, and this has a number 1 and number 2. And so this is a cardboard part back here, so that will not go on to my sterile insertion site. So with my sterile glove, I'm going to grab the actual dressing. and pull that off. So this is the actual sterile part. This is not. So that's why my non-sterile hand is touching this kind of cardboard-like backing here. And then you would just pull it off. Okay, and get rid of that. And then this right here is touching another part, okay, that gets peeled back. And we'll go over the side here. Okay, and of course we'd have to wait for that to dry for that to actually stick. But pinch this, center it up, and pinch this air-occlusive dressing around your tubing here. So you want to pinch that really good around the tubing here and make that air-occlusive to where air bubbles can't get into there. Then you take this part that you touched with your non-sterile hand, okay, and that is the number 2 part, and it just peels back, okay, and when you peel that back, all right, it leaves the transparent dressing on there, all right, and so you have that. So all non-sterile stuff is gone. And so then what you want to do is take your piece of tape and put it over your thing here. And most of them will have a label that you put on there. You will label it, date and time, all that. If you don't have that on your tape there, you want to write your date, time, initials, and that's it. Okay. And so then you're going to clean up your mess, remove your old gloves in the appropriate fashion so that you don't get any contaminants on you, and drop those also in your biohazard bag. And you are finished. Everybody may now take off their masks.